Hey everyone, welcome back to Corporate Decoder, the place where we decode the language of money and business to see if companies are truly living up to their hype. Today we're diving into Telomir Pharmaceuticals, and let's just say their latest report has some interesting science behind it, but we'll see if it translates to real-world success. So what's the big news from Telomir Pharmaceuticals? Well, they're talking about something called Telomir 1, their main drug candidate. Think of it as a potential new weapon against cancer, aging and other diseases that pop up as we get older. They've been doing lab tests called in vitro studies, and the results are pointing towards Telomir 1 having a dual action, meaning it does two important things. First, it seems to be targeting something called DNA methylation. This is like a dimmer switch for our genes. Our genes have instructions, and DNA methylation can turn those instructions up or down or even off completely. When this system goes wrong, it can lead to problems like cancer and other age-related illnesses. Telomir 1, by inhibiting a specific enzyme called UTX, might be able to fix these faulty gene dimmers, resetting them to a more normal, healthy state. This is pretty significant because problems with UTX have been linked to serious conditions like cancer and even autism spectrum disorder. But that's not all. Telomir 1 also targets other important enzymes that play a role in how our genes are expressed. We're talking about FBXL10, FBXL11, and JMJD3. These are all linked to things like cancer growth, inflammation, issues with how our bodies use energy, and even problems with how the brain develops. So this drug candidate seems to be hitting multiple targets involved in disease. Now, here's a really crucial point for any new drug safety. The report highlights that Telomir 1 doesn't seem to affect another enzyme called GCN5L2. Why is that important? Because messing with GCN5L2 can cause a lot of bad side effects. The fact that Telomir 1 leaves it alone suggests it might have a safer profile compared to other drugs in this area. That's a big deal when you're trying to develop therapies for serious conditions. The second key action of Telomir 1 is its effect on something called tankerases. These are part of a pathway that cancer cells often use like a fuel line to grow uncontrollably. The report says Telomir 1 has a modest effect on this pathway. This is interesting because very strong inhibitors of tankerases can have safety issues like shortening our telomeres, which are like protective caps on our chromosomes. Telomir 1's Welker-IS studies in models of accelerated aging showed Telomir 1 actually helped lengthen telomeres, which is the opposite of what some other drugs do. So putting it all together, Telomir 1 is shaping up to be what they call a first-in-class epigenetic therapy. That means it's a brand new type of treatment. Its dual action is to reset faulty gene regulation by influencing DNA methylation and to gently interfere with the pathways that cancer cells use to grow. This dual approach targets the root causes of several diseases, which is a very promising strategy if it pans out. Now, while the science sounds compelling, it's important to remember this is all based on lab tests. Telomir Pharmaceuticals itself is described as a preclinical stage company, meaning their drug candidate is still in the early stages of development. They have common stock trading on the Nasdaq under the ticker TELO. They are also checking the box to say they are an emerging growth company. This usually means they meet certain criteria for smaller companies and might have some flexibility in reporting rules, but it also suggests they are still in an early phase of growth and development. In terms of their public trading, their common stock is pretty standard with no par value, and it trades on the Nasdaq Stock Market LLC. This is where investors can buy and sell shares of the company. Looking at the filing itself, it contains the usual formalities. The report document is signed by Erez Aminov, who is the Chief Executive Officer of Telomir Pharmaceuticals, on August 27, 2025. This signifies the official release of this information by the company. Now, let's talk about what this all means. The science behind Telomir 1, particularly its potential to reset gene expression and its dual mechanism of action, is genuinely exciting. The ability to target specific epigenetic pathways that are implicated in a wide range of diseases, from cancer to aging and neurodevelopmental disorders, is a significant area of medical research. The fact that Telomir 1 appears to avoid the toxicities associated with inhibiting certain other enzymes and its potential positive impact on telomeres are strong points in its favour. However, it's crucial to maintain a balanced perspective. These are in vitro results, meaning they were achieved in a lab dish, not in humans. The real test will come with clinical trials. Many promising lab results don't translate into effective and safe treatments in people. The company is also in the preclinical stage, which means there's a long road ahead, full of significant scientific, regulatory, and financial hurdles. The financial performance details aren't in this particular filing, but for a company at this stage, funding its research and development will be a continuous challenge. Investors need to be aware of the high risk associated with preclinical biotech companies. The company's direction seems focused on pioneering new epigenetic therapies, which is a cutting-edge field. The opportunity lies in the potential to address diseases with currently limited treatment options. A key risk is simply the failure of the drug to prove effective or safe in human trials, which is a common outcome in drug development. Another consideration is competition from other companies exploring similar epigenetic approaches. In conclusion, Telomir Pharmaceuticals is making waves with promising early scientific data for its drug candidate Telomir 1. The science points towards a potentially novel and safer way to combat serious diseases. But as always, the journey from lab bench to medicine cabinet is long and arduous. Keep an eye on their progress through clinical trials and remember the inherent risks of early stage biotech investment. What's your take on these scientific breakthroughs? Do you think Telomir 1 has what it takes to become a real world therapy? Let us know in the comments below. If you found this deep dive valuable, please hit that like button and subscribe for more corporate insights. Also, make sure to join our Discord community to continue the conversation, link in the description. Thanks for tuning in to Corporate Decoder. See you next time.